This is a right clavicle. This is the sternal end, and this is the acromial end. You can tell it's a right because it goes forward away from the body and then comes back towards the body. And the top is smoother and the bottom is less smooth. This is a left scapula. This is the subscapular fossa, the medial border, the lateral border, the inferior angle, the coracoid process, the glenoid fossa or cavity, the acromion process, the spine of the scapula, the superior angle, inferior angle. This is the superior border, the suprascapular notch, supraspinous fossa, infraspinous fossa. This is the left humerus. This is the head of the humerus, the anatomical neck, greater tubercle, lesser tubercle, intertubercular groove or bicipital groove, and this is the surgical neck, and then you have the deltoid tuberosity, the coronoid fossa, the radial fossa, the capitulum, the trochlea, which is this, the medial epicondyle, lateral epicondyle, olecranon fossa. This is a right radius. This is the head of the radius, the neck, the radial tuberosity, and the styloid process. This is a right ulna. This is the trochlear notch, the coronoid process, the olecranon process, the radial notch, the head of the ulna, and the styloid process. This is a right hand. The carpals are the scaphoid, the lunate, the triquetrum, the pisiform, the trapezium, the trapezoid, the capitate, and the hamate. The metacarpals are numbered lateral to medial 1 through 5, with the thumb being the first. So this is the first metacarpal, this is the base, and this is the head. This is the second metacarpal, third metacarpal, fourth metacarpal, and fifth. This is the proximal phalanx and the distal phalanx. This is the proximal phalanx of the second digit, the middle phalanx, and the distal phalanx. Proximal, middle, distal phalanx are these. The thumb is different because it only has a proximal and a distal and not a middle phalanx. These are 3 carpals. This is the hamate bone, this is the scaphoid, and this is the pisiform. This is a right pelvis. This is the ilium, the ischium, and the pubis. This is the iliac crest, the iliac fossa, and then you have the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine, the superior ramus, inferior ramus, ischial ramus, ischial spine, ischial tuberosity, the greater sciatic notch, the lesser sciatic notch, the pubic symphysis, the obturator foramen, and the acetabulum. This is a right femur. This is the head of the femur, the neck, and then you have the greater trochanter, lesser trochanter, intertrochanteric crest, the gluteal tuberosity, the linea aspera, the medial condyle, lateral condyle, intercondylar fossa. This is the intertrochanteric line, the patellar surface, the medial epicondyle, and the lateral epicondyle. This is a right patella. This is the base, which is superior, and the apex, which is inferior. And you can tell that it's a right because when you sit it down, it leans to the right. This is a right tibia. This is the tibial tuberosity, the anterior crest, the medial malleolus, and then you have the lateral condyle and the medial condyle. And then on top, you have the intercondylar eminence. This is a fibula. This is the head of the fibula, the neck, the shaft, and the lateral malleolus. This is a right foot. There are 7 tarsals per foot. This is the calcaneus, the talus, the navicular, the cuboid, and the 3 cuneiform. The metatarsals are numbered medial to lateral, starting with the hallux, which is number 1. This is number 2, 3, 4, and 5. This is the base of the metatarsal and the head of the metatarsal. When it comes to the phalanges, the hallux is different because it only has a proximal phalanx and a distal, but digits 2 through 5 have a proximal, middle, and distal. These are 3 tarsals. This is the talus, the calcaneus, and the navicular. This is the lateral longitudinal arch, the medial longitudinal arch, and the transverse arch.